My name is Johnny Slaughter. I'm located in Baltimore, Maryland. Believe it or not, I started doing ultrasound in the mid 80s. I was doing working on a PhD at Michigan State University. Then we had a colony of naturally hypertensive Siberian Huskies. And we were measuring levels of hypertension. And what we did was we partnered with the University of Michigan's medical school. And we snuck in our Siberian Huskies into the medical school, into the pediatric unit. The ultrasound was huge, as you could imagine, in 1985, 86. It took up almost the entire room. And so that's when I started. Then when I started my house call practice, of course, they had gotten much smaller, size of a what would I call it? A large carry-on bag, but thick, square size, that looked like a huge 1990s television set with a big backside and then a flip down keypad. That was a early Mind Ray portable. And then I decided to get serious during the pandemic when I could not get my house call patients into an internist because they were so swamped. And they were only taking patients in from individuals who had a relationship with a particular major corporation or venture capital company that was they had corporate relationships with. So as a result, I recognized that I needed to learn this technology myself. And that is when I became interested in studying it with the latest technology. And that was 2019. And since then, I have taken courses at many different venues, both beginning, intermediate, and advanced abdominal ultrasound. And I am now training in musculoskeletal and in towards more knowledge and point of care. I started off with a piloter, and then after a year or so, outgrew that because I wanted to become more diagnostic. I wanted to be able to identify that pancreatitis and or those adrenal issues. And now really excited about the expansion with musculoskeletal and the new linear probe that they're having that's coming out. So I'm just really ecstatic about how I am growing and the fact that I'm with a company that's growing with me. I cannot exclaim how excited I am about that. Having an ultrasound with me at all times, providing point of care service, which I call the new stethoscope. Having a point of care ultrasound is immensely important because clients then can get a real time answer to some very hard questions. And for me, that was the selling point of making that investment. So to answer your question succinctly, it wasn't much when I first got started because I didn't have the opportunity. It took way too long. But now I do relief in various hospitals in and around the Baltimore metropolitan area. And more importantly, for my house call clients where I do not have to rush and come in, sit down, the pets are relaxed. I oftentimes don't even have to sedate to do a good point of care ultrasound or an abdominal ultrasound with the pet in the home environment, which is a tremendous plus for my clients. I use it every day. So I'll use it so to answer your question, if I'm in a veterinary hospital working relief, I'll see anywhere between 20 to 30 pets a day. Of those pets, that require evaluation from a abdominal point of view, there may be 5, of which 2 will require a extensive abdominal ultrasound and sending it off to one of the services that provides a special support. I have a board certified radiologist that reviews my images. I just DICOM them right over, type in the history on my iPad. He or she receives the images and then can report back to me, usually within an hour or so, to provide that client with the answers they're looking for. And this is the beauty right now of practicing medicine with a combination of DICOM and image capture. Anyone, anywhere can work from their home and help practitioners like myself do a better job of educating, informing, and diagnosing many, oftentimes complicated conditions. I had a case just over the weekend at an emergency hospital that we were treating as a mild inflammatory situation until we got the results back and found out this dog, in fact, had multicentric intestinal cancer of the liver, lymph nodes. And the owner was like, oh my goodness, I had no idea. Even the 20-year veterans in the ER did not recognize that this was a cancer situation. And because I was there with probe in hand, we were able to help that pet parent make some serious decisions right then and there before taking the time to hopefully get to an internist in a short period of time to really help the pet be more comfortable. Because now we could say, look, these are what's going on. Let's get some good pain meds on board because this is more serious than what we thought before. It's fun to get the staff involved because when they're involved, 2 things happen. The pet has a better outcome because the pet pet nurse becomes involved, and we all want to see that when we're working with staff that's excited about being there and pets that are able to go home either feeling better or at least the pet parents having knowledge about what was happening with their pet during their time with us. And then to them, that's wonderful because I remember as a vet tech in the years when I was growing up, I wanted to be involved in any kind of way outside of just help lifting up pets or restraining pets or dipping the x-rays into the canisters to let them dry. Being able to do something other than what I call the routine jobs that most vet techs do is exciting because it increases their learning. What I would say to a person who's excited about ultrasound is to gauge how much time you have to study outside of the clinic. Do you have 2 hours 2 or 3 times a week to just sit down and pull in your anatomy, your physiology, and your pathology together, and recognize that all these things come together to help you be a better pet parent pet practitioner, because your job is to help that pet parent see what you're seeing and understand what you're seeing. And if you can do that, the ultrasound will become what I call the next stethoscope. It is the tool that is the most important outside of the microscope to help you and your pet parents understand what's going on in today's veterinary medicine standard of care.